I'd like to introduce Dr. Carla Repper. She's a psychologist and has many different experiences in the field of assessment and evaluation and diagnosis of young children. And Dr. Repper, welcome.
Thank you.
Tell me a little bit about your background, some of the different roles that you've played in regard to assessment.
Yeah, so I'm a clinical psychologist, and what that means is that during my training I had lots of opportunities to evaluate children across age ranges, but I had a lot of experience specifically evaluating young children, so children from about 3 to, as they're starting school, so about the kindergarten age.
Okay. The class that we're working with in conjunction with this interview focuses on birth to 8.
Great.
So any experiences in that range will be very helpful for you to share. Tell us a little bit about some of the settings you've worked in.
Wow, I've worked in inpatient and outpatient clinical settings. So I did years of outpatient evaluations when I was in the university studying as a practicum student. I've worked in private and publicly funded clinics, so I've seen a variety of patients. So I've seen children whose parents could pay out of pocket for a very elaborate and long evaluation, and I've also seen children whose parents needed grant funding to receive the services. So I've seen a lot of different kinds of children from different families.
Okay. What type of problems or syndromes do you look for in your evaluation of young children?
It's really highly variable. It really depends on the concerns that are brought to us by the parents or the pediatrician or the teachers. But some of the kinds of things that I've evaluated the most are concerns about learning, so whether or not there's a specific learning disability, such as reading or writing or something like that, speech and language issues, autism spectrum disorders, so things like Asperger's and autism disorder. ADHD is a common referral, and social, emotional, and behavioral functioning in general are also things that come across my lap.
And in your role as a psychologist, you do the formal diagnosis, is that correct?
That's right.
Okay.
Right.
And since we're talking to educators, what kind of information from an educator would be helpful to you?
Well, educators are extremely valuable. They provide a huge piece of the puzzle when I'm doing an evaluation. The reason is that they spend all day long with the child that's being evaluated. And also, probably the most important thing is that they see the child in context with other children their same age and same gender, which is kind of the most comparison point when you're thinking about whether a behavior is sort of outside of the normal range. It's relative to children who are the same age and same gender. And teachers have that information. They have the opportunity to observe all day long what this child does, what they do with language, what they do in the interactions with the teachers, whether or not they follow directions, how they play with other children. Their expertise and observations are critical when we do evaluations.
And how do you gather that information from teachers?
It's a good question. So there's a variety of ways that people do it. My preference is 2 ways. One is asking the teachers to complete a standardized questionnaire that asks about a variety of problems that can crop up in early childhood. The other way is to call them on the phone or pop up in their school and do a one-on-one interview. Quick, because I know their time is valuable, but just to ask them some specific questions about the child.
Okay. Could you talk to us a little bit about objective and subjective observations from teachers? Is a subjective point of view valuable to you, or do we need to strive totally for objective types of evaluation and observation?
That's a good question. So objective, I think you mean the kind of standardized forms that I would ask a teacher to fill out. That's incredibly important, because what that does is relieve some of the pressure on the teacher to sort of make the final word of whether or not what they're describing is normal or abnormal for a particular child. That allows us to compare the child, in a sense, to thousands of other kids whose teachers have filled out the same similar questionnaires. But the subjective information is really important. Many teachers have lots of experience for many years with lots of kids that same age and same gender, and can provide that unique context for that specific child. So they can give sort of situational examples of problematic behavior and can help put it in context specific to their classroom. And so both are actually quite important.
Can you tell me a little bit about some of the different types of assessment and evaluation instruments you use with the child other than gathering information from the teacher? When you give specific tests that are designed for different things, what types of instruments do you use?
Yeah, well, the way it works is when a child and a family comes in for an evaluation, there's a particular referral question, and that's sort of, what everybody thinks might be the issue, and we kind of want to check and see if that's what's going on with the child. But there's some standard things that are done regardless of the referral issue. So things like an IQ or general ability test to kind of see where the child's abilities lie. Then we also do some early learning, depending on the age of the child, or academic testing to see if that kind of matches up with what you would expect them to be able to do given their estimated abilities. And then we do a variety of social and emotional testing. So we can do that one-on-one with the child, and we can also have parents report to us via these kind of standardized questionnaires and that kind of thing. So there's, the key is to do sort of a multi-pronged approach. You work one-on-one with the child, you get them to do some activities, you interview parents and interview teachers, and then you get kind of a comprehensive picture of the child.
Okay. Just as a general type of advice to teachers, and I know that often we're in the position, we're the first contact for the parents. We see them, we see their children.
That's right.
Day in and day out. And often we'll have questions from parents such as, do you think my child has ADD?
Right.
And what advice would you give to teachers in fielding those types of questions?
Well, I do think that, kind of the most important thing is for teachers not to minimize their role and think that they don't play a huge part in helping parents get to the position that they need to be in order to have their child effectively evaluated. Teachers are really critical. Like you said, they're often the first folks who say to a parent, listen, there's something kind of going on with your child, and I think you'd do well to get him or her evaluated. But I also think that teachers sort of need to realize that they don't have to have all of the answers. That's not really their job. Their job is to teach, and then also to realize when something's not going quite right. And so I think sort of balancing the weight of the responsibility and also understanding that they don't have to have all the answers. I think that that's probably the biggest piece of advice that kind of frees teachers up for making that step with parents and encouraging to have their child evaluated, or encouraging the parents just to simply mention their concerns to the pediatrician. That can often be a really important first step too.
Okay, thank you.